Welcome back. A reminder of our breaking news story this hour. Cabinet has pushed the country to lockdown level 3. The tighter measures come amid increasing COVID-19 infections concentrated mainly around Gauteng.
Restrictions include a revised curfew from 10 p.m. to 4 a.m. and a limit on the number of people allowed to gather. 50 people maximum indoors, provided there's social distancing, and 100 people outdoors. There are also fresh alcohol restrictions in place.
The Cabinet has therefore decided to move the country to alert level 3. This will take effect later this evening once the regulations have been gazetted. This means that, 1, the hours of curfew will start at 10 p.m. and end at 4 a.m. Second, non-essential establishments like restaurants, bars, and fitness centers will need to close by 9 p.m. to allow their employees and their patrons or customers to travel home before the start of the curfew. All gatherings will be limited to a maximum of 50 people indoors and 100 people outdoors. Where the venue is too small to accommodate these numbers with appropriate social distancing, then no more than 50% of the capacity of the venue may be used. This includes religious services, political events and social gatherings, as well as restaurants, bars, taverns, and similar places. Next, attendance at funerals and cremations may not exceed 50 people, and all social distancing and health protocols must be observed. Night vigils, after funeral gatherings, and after tears gatherings are not allowed. The sale of alcohol from retail outlets for off-site consumption will only be permitted between 10 a.m. and 6 p.m. from Monday to Thursday. This excludes public holidays. Alcohol sales for on-site consumption will be permitted as per license conditions up to 9 p.m. Alcohol consumption in all public spaces, such as beaches and parks, is strictly prohibited.
President also announcing this evening that new cases are increasing rapidly, as our hospital admissions have increased markedly in the last 14 days.
Yeah, Ramaphosa has expressed concern about the rising infection numbers.
We have recorded an average of 7,500 daily infections. Hospital admissions due to COVID-19 over the last 14 days are 59% higher than the preceding 14 days. The average number of people who die from COVID-19 each day has increased by 48% from 535 2 weeks ago to 791 in the past 7 days. With the exception of Northern Cape, all provinces are experiencing rising infections. 4 provinces, Gauteng, the Free State, Northwest and Northern Cape, are officially in a third wave, while others are approaching that point.
Well, despite delays and several mistakes in acquiring COVID-19 vaccines, the President says the country's inoculation drive is on the up and up.
Yeah, that's good news, right? Ramaphosa says the Johnson & Johnson vaccine is the country's best option, as it only needs 1 dose.
We are all aware that our vaccination program has experienced several delays. Our first setback was that after the arrival of our first batch of vaccines, our scientists discovered that the AstraZeneca vaccine that we had procured from the Serum Institute of India did not provide sufficient protection against the variant that is predominant in South Africa. We have also been adversely affected by shortages in the global supply of vaccines, which has hampered vaccination programs across Africa and in many other low and middle income countries. After the AstraZeneca setback, the Johnson & Johnson vaccine appeared to be the best option for our country, as it protects against the variant that we have here, because it requires only a single dose and is easier to store and transport. However, the supply of Johnson & Johnson vaccines was held up by an investigation into contamination of ingredients that make up the vaccine at a supplier factory in Baltimore in the United States.